all prices for consumers.
Well, we are midway through National Non-Smoking Week, making this Weedless Wednesday. Lisa Hefner joins us live with more on what the province is doing to promote a healthier Ontario.
Hi, Donna. Well, we were talking about how the national smoking rate is about 17%. In Ontario, about 19% of people smoke. And in Hamilton, it's even higher, 21%. There's a huge disparity of people in Hamilton who smoke. I have Dr. Richard Tytus with me. He teaches family medicine at McMaster University. You also have a family practice right downtown Hamilton at Main and Sherman, where the smoking rates are even higher. Explain that.
Yeah, it's embarrassing, but downtown Hamilton, in my practice, the rate is 25%. So if you look at national, it's 17%, and downtown Hamilton, it's 25%. That's huge.
That's 24 people.
Yeah, that's 1 in 4 people. And that's not even counting the people that used to smoke, no longer smoke.
Okay, so what do you tell these people? What do you do? How do you address this problem?
Well, I think the issue came up was when they had the Code Red. And when they had, or with Code Orange actually, when they had that out, and they found out, depending upon where you lived in Hamilton, you had an increased chance of dying sooner. So if you're in the downtown North End, you're looking at life expectancy of 65.5. If you lived in the suburbs, Ancaster, you're looking at 86.
So you live in Ancaster, you'll live 20 years longer. That's crazy.
Maybe we should all move.
Do you think that's the problem?
Well, I think we have to address the issues. Okay? And one of the issues, what we decided was we have to act together. All the healthcare workers in the city have gotten together, and we're working together to make a difference. And
because Hamilton really, like you were saying, Hamilton is unique in Canada. We've got these gross disparities between neighborhoods.
Absolutely. So what we've done at the Hamilton Academy of Medicine, we said, okay, let's make a difference. Okay, working as a community of healthcare providers, we can make a difference. So that's what we're doing this week. It's Hamilton's Time to Quit, and we want all Hamiltonians to take up the charge.
So specifically, tell me about what you're doing. I think next month you've got some forums for people. How will that help?
Well, I think the forums are, we want to empower people. We want to tell them, okay, this is what you can do. This is how you can make a difference. And I think at these forums, you're going to be able to get some nicotine replacement. At these forums, you can register for Driven to Quit. You can win a car. You can win a vacation. You can win like gift certificates. So it's something to motivate individuals.
Have you ever had a patient who was surprised when you told them that smoking was bad for them?
Well, you know, like I think we all are aware that smoking is bad for you. But when you tell a patient, the patient looks at you and say, Doc, you know, I'm not going to die sooner. I'm not going to get cancer. It's my neighbor. It's not me. Okay? So they don't believe it. Okay, you tell them, but they don't believe it. But we want to impact on each individual. Like, a patient comes to me and says, Doc, you know, how can I live longer? If you're a smoker, if you are a smoker, and if you stop smoking, you can live 10, 15 years longer. After a year of stopping smoking, your heart attack rate falls by 50%.
Do you also have patients asking you or telling you that they can't afford to quit smoking because the remedies are very expensive in this country?
Lisa, that is a very big problem. So a patient comes to me and says, Doc, I want to stop smoking. I think right now there's 1 million people in Ontario that say we want to stop smoking. So they come to the doctor writes a prescription, and the patient looks at the prescription and say, how much will this cost? So that's a big barrier.
Because it's easier to set aside $10 a day or every few days to buy a pack of cigarettes than it is to spend $100 on a bottle of pills.
Well, and the problem is in Hamilton, my patients actually, they can get contraband cigarettes or reserve cigarettes, and they have this bag of cigarettes. You can get like 200 cigarettes for $15. So they can't afford. They want to stop smoking, but they can't afford the smoking cessation products, which is really big.
So bottom line, see your family doctor. If you're a smoker, you should quit. And driventoquit.ca, you can win a car if you do that next month, right? Doctor... Sorry.
Yeah, absolutely. And this year, this week actually, what we're doing is, because the campaign is with the Hamilton pharmacists, the family health team, the public health, wherever you go, you're going to hear the same story, same messaging. You go see your family doctor, you go to the pharmacist, you go to the specialist. So help us help you.
Thanks very much, Dr. Richard Tytus, family medicine professor at McMaster University and a practitioner of family medicine as well, downtown Hamilton. Donna?
Thank you, Lisa, and let's go over to Brian Wood now, who's standing by to tell us if you like being outside, well, you're probably going to be spending a lot of time in the next few days shoveling snow.
Well, we can